Hello and welcome. Today we're diving into a rare and serious lung disease called pulmonary veno-occlusive disease, or PVOD. This condition primarily affects the small veins in the lungs, leading to significant complications. Join us as we explore the causes, symptoms, diagnosis, and treatment options for PVOD. The exact cause of PVOD is often unknown, making it a challenging disease to understand. However, several factors have been associated with its development. These include genetic mutations, particularly in the EIF2K4 gene. Exposure to certain chemotherapy drugs, particularly alkylating agents, has also been linked to PVOD. Additionally, bone marrow transplantation and certain autoimmune diseases can increase the risk. In some cases, no identifiable risk factor is found, and the disease is considered idiopathic. PVOD's core problem lies in the progressive blockage, or occlusion, of the small pulmonary veins. This occlusion is caused by the thickening and narrowing of the vein walls due to fibrous tissue growth, as well as the formation of thrombi, or blood clots. As these veins become obstructed, blood flow from the lungs back to the heart is severely restricted. This leads to a buildup of pressure in the pulmonary arteries, a condition known as pulmonary hypertension. The increased pressure then causes strain on the right side of the heart, potentially leading to right heart failure. PVOD is a rare disease, making precise epidemiological data difficult to obtain. It is estimated to affect less than 1 to 2 people per million. It can occur at any age, but it is slightly more common in children and young adults. Because it mimics other pulmonary hypertension types, such as pulmonary arterial hypertension, it's likely underdiagnosed. The symptoms of PVOD can be quite varied and often mimic those of other lung diseases, making diagnosis challenging. Common symptoms include shortness of breath, especially during exertion, fatigue and weakness, a persistent cough, which may or may not produce blood, chest pain, and swelling in the ankles and legs, indicating fluid retention due to heart failure. As the disease progresses, these symptoms tend to worsen, significantly impacting quality of life. Diagnosing PVOD requires a multifaceted approach. Doctors start with a thorough medical history and physical examination. A chest X-ray can reveal signs of pulmonary hypertension and fluid buildup. High-resolution computed tomography, or HRCT scan, of the chest is crucial, often showing characteristic features like enlarged pulmonary arteries, thickened interlobular septa, and ground glass opacities. Pulmonary function tests are done to assess lung capacity and airflow. The gold standard for diagnosis is a lung biopsy, which allows direct examination of the small pulmonary veins to confirm the presence of veno-occlusive changes. Pulmonary angiography may also be used to visualize the pulmonary vasculature, but is not always definitive. While there aren't distinct classifications or types of PVOD in the same way as some other diseases, it's important to recognize the potential for underlying causes. Differentiating between idiopathic PVOD and PVOD associated with genetic mutations, chemotherapy, or other underlying conditions is important, as this might impact management strategies. Unfortunately, there is no cure for PVOD, and treatment focuses on managing symptoms and slowing disease progression. Oxygen therapy can help improve blood oxygen levels and reduce shortness of breath. Diuretics are often prescribed to reduce fluid retention. Anticoagulants, or blood thinners, may be used to prevent blood clot formation in the pulmonary veins. In some cases, medications used for pulmonary arterial hypertension might be tried, but they are often less effective in PVOD and can even be harmful. The ultimate treatment option for eligible patients is lung transplantation. This involves replacing the diseased lungs with healthy donor lungs, offering the potential for improved survival and quality of life. Currently, there are no proven methods to prevent PVOD, particularly when the cause is idiopathic or genetic. However, avoiding unnecessary exposure to chemotherapy drugs known to be associated with PVOD may be prudent. Early detection and prompt management of underlying conditions that may increase the risk, such as certain autoimmune diseases, might also play a role. The prognosis for PVOD is generally poor, with a median survival of only a few years after diagnosis without lung transplantation. Early diagnosis and treatment, as well as consideration for lung transplantation, are crucial for improving outcomes. Recent research focuses on identifying novel therapeutic targets and developing more effective treatments. Scientists are also working to improve diagnostic accuracy and identify biomarkers that can help predict disease progression. Furthermore, research into the genetic causes of PVOD holds promise for developing personalized treatments in the future. Our understanding of PVOD is constantly evolving, and ongoing research offers hope for better outcomes for those affected by this challenging condition.